Welcome, and thank you for joining us today. Please give us a moment before we begin. We're going to wait for others to join. Thank you. Just getting all these kind notes from the chat. Everyone's saying how excited they are about today's presentation. So thank you.
How nice.
Yeah. Give it another minute. Wonderful. Thank you. Well, welcome everyone. Thank you everyone for joining us today. I'm really excited. My name is Jonathan Salzberg. I'm the Executive Director of Strategic Partnerships and Growth for Caron, as well as the Regional Resource Director for Southeast Florida. And I'm really excited today for this presentation that we're going to be hearing from the great Dr. Marks. We are talking about signs and symptoms of sex and love addiction and the link between relationships and relapse. As a reminder, we will be conducting this session in a webinar phone format, meaning all participant microphones will be muted. We will not be able to see or hear you. However, during the presentation, although the chats will be turned off, you may utilize the Q&A feature. And if we're unable to get to your question before the end of this presentation, we will certainly follow up with you after the session. Additionally, the presentation, the slides, and the recording of the webinar will be emailed to you once they are available. So thank you. Today's presentation is eligible for one continuing education credit. Please, 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 the evaluation will be emailed to you after the presentation from cego.com. You'll need to complete that evaluation to get that credit. And the certificate of completion will be available to download after you take the evaluation. You do need to be on for the duration of the webinar to receive the credit. So thank you. So thank you. The influence of media dating apps can be linked to a rise in sex and love addiction, and those in early recovery are especially vulnerable. Transitioning from substance use disorders to seeking fulfillment from relationships can lead to risky behaviors and ultimately lead from power to choose to being powerless over the desire for intimacy, despite any negative consequences. By empowering our patients to prioritize self-love and understand the hallmarks of healthy, intimate relationships, we can reduce their risk of recurrence of use and guide them towards a genuine, lasting intimacy. Today, Caron Treatment Centers is proud to welcome a foremost expert on this topic, Dr. Donna Marks. Dr. Marks is a consultant, educator, public speaker, licensed psychotherapist, and addictions counselor in private practice in Palm Beach, Florida, with over 35 years of experience. She's a certified addictions professional, certified Gestalt therapist, certified psychoanalyst, hypnotherapist, and certified sex therapist. She developed a chemical dependency treatment program at Palm Beach Community College in 1989, which has since grown into a 4-year degree program, and granted her the Award of Appreciation from the college and the Florida Governor's Award. Over the years, she has served as a consultant in numerous treatment centers and is the co-owner of the Addiction Training Center in Davie, Florida. Dr. Marks is the author of several books, including the multi-award winning Exit the Maze, One Addiction, One Cause, One Solution. Dr. Marks, thank you for joining us today. We're looking forward to your presentation.
I'm so excited to be here, and it's just wonderful seeing all these people send these little messages. It's a great group, and I'm very excited. Okay, so let's get started. As most of you that are watching already know, either you have personally experienced love addiction, sex addiction, or both, or you've had patients that have suffered from this problem. And it's something that in treatment we really need to address, and we need to address it before it's too late, because it is a serious problem with relapse. And there's a very strong connection between people staying sober and learning how to have that most important relationship of their lives, the one with themselves. So I want to go ahead and let you know ahead of time that I never take a punitive approach. It's not about shaming someone or making them wrong or anything like that. What we want to try and strive to do is educate people that it is a problem. And as I say in my book, there's just one addiction and it's going to move around on us. So a lot of times people will get sober from drugs and alcohol, and then, like myself, turn immediately to relationships to get that fix. And so that in the long term is debilitating to a person's self-esteem. We often don't understand what's happened to us or why we're doing this. And so the presentation today is going to cover, the seriousness of the problem, what are the signs and symptoms of the problem, and what we can do about it. Because we want people to be free from this. We want people to have sobriety that is happy, joyous, and free. And if we're still in that bondage of sex and love addiction, that's not going to happen. So let's go to page 2. Thank you. So again, what I just said, people who are newly sober are really vulnerable. And we want to be able to help them to understand that just because you stop using drugs and alcohol or whatever you're being treated for, whatever addiction, there's so many, work, sex, love, sugar, pornography, shopping, gambling, the list is endless. So we want people to understand that just because they get treated for that number one thing that brings them down, that brings them to hitting bottom, that is only the beginning of recovery. And that what I like to do when I'm working with people is to pre-screen them. And I have a self-evaluation questionnaire that's a generic questionnaire that helps people to identify whatever types of things they might be addicted to. So what I would really encourage people to do in treatment is not just stick with that number one type of problem. Let's help them to see other signs and symptoms of other things as an educational component. I'm sure a lot of you have seen people in treatment get involved while they're there. And again, I don't want to shame people or make them wrong, but when we educate people, they're less likely to make the wrong choices and more likely to make choices that are in their best interests. Let's go to page 3, please. Okay, let's go to page 4. I've already talked about my background. Okay, so sex and love addiction is when someone continues, like any other addiction, to do the same thing despite negative consequences. And sex addiction is when someone is having sex to the point that there is negative consequences. And same thing with love addiction. I'm having a little trouble here with the screen because my screen, we're having internet problems, so I apologize for that. So I'm gonna have to sit a little closer to the screen. So with sex addiction, according to the Journal of Psychosexual Health, it is the inability to control one's sexual behavior. It's also the inability to stop behavior that progressively becomes emotionally or physically harmful to oneself or others. It can be solo or with others. In other words, someone may be just acting out alone to the point that is causing negative consequences, or they may be doing this with one or more partners. So let's go to the next page, please. Okay, so types of addiction. And we also have some questions and answers. So I understand that a lot of this might trigger a lot of questions. So we will have that opportunity at the end for you to email in your questions if we don't cover them today. So the types of addiction, insatiable sex with a specific partner. So this is more of the co-love addict, sex addict type of model. Although sometimes there's no love involved, people are just having intense addictive sex with each other, and they are, one or both people are clear that it is not a romantic relationship. Insatiable sex with oneself. This is chronic pornography, chronic self-pleasuring and masturbation, and to the point, again, that it's causing negative consequences. And when we talk about negative consequences, by the way, we're talking about emotional, spiritual and physical. So a lot of times people will be, if it's a spiritual problem, they will be substituting that high of sex and orgasm for the high of being spiritually connected. Emotionally, they can feel out of control, they can feel guilty, they can feel ashamed, they can feel embarrassed. It can be causing harm in a relationship with another person. And so that would be the emotional component. And so it affects people on every level, even physically with chronic sexual behavior. There's often physical consequences. It could be all kinds. We're going to go a little bit more into this later, but it could be anywhere from physical, permanent self-harm to even death. But we'll talk more about that later. The third type of sex addiction is sex with multiple partners. And I also want to kind of clarify here because, and we will talk more about this later too, but sometimes people do these kinds of things and it's not compulsive. So what you want to look for when we use the word addiction is what are the consequences to the choices and behavior. Okay, then there's the compulsive pornography, where someone is on the internet to the point that it's threatening their relationship, it's threatening their career, their job, and it's all preoccupying, just like any other addiction. And then there's sadomasochism, which is with the sado component is wanting to inflict harm on another to be able to get off sexually, and the masochist needs to be degraded or hurt psychologically or physically in order to seek that ultimate pleasure. And so that has become very popular nowadays. One of the things I talk about in the preview is, with 50 Shades of Grey coming out, people are wide open to all kinds of experimentation. And again, we're not talking about experimentation here. We're talking about people that are doing these types of things to the point that they're suffering some type of emotional, spiritual, or physical consequence. And then there's the fetishes. This is where someone has to have a particular thing happen or object in order to be able to have sexual pleasure. It could be, these types of addictions could be criminal, or they could just be normal types of things that people are doing, and then they wind up getting addicted. There's a difference between normal and healthy. Okay, so just because something might be normal nowadays doesn't mean that it's necessarily healthy. So let's go to the next page and we'll talk more about that too. Thank you. This problem has become very severe. There are 4.7 million US adults that spend more than 11 hours per week looking at pornography online. The dating apps for sex hookups, not dating, but just to hook up sexually, are over 100 million users, and approximately 24 million Americans suffer from sex addiction, according to the Mayo Clinic. And then 13-stepping, flirting, using meetings, 12-step meetings as a source for dating, are seeking sexual pleasure is a very serious problem in recovery. And hooking up while in treatment is also a very common problem. And I know that people are advised not to do this. Again, we can't just really tell people what to do. What I'm encouraging those of us in the profession to do is to provide the education. If you just tell people they shouldn't drink, that's going to make them want to drink more. But when we explain to them that alcohol can be poison in their body and help them to understand the consequences, and most importantly, how to learn healthy alternatives behavior, they're much more likely to make healthy choices. A lot of times people get mixed messages in the rooms and in treatment, particularly about sex and love addiction. So we're going to clarify some of that as we go on. One of the things I want to clarify now is that not all deviations are addictions. A society, particularly in America, generally looks at marriage or monogamy as having one partner at a time. But that, in some societies, that isn't the case. So we don't want to call them addicts. And sometimes an affair, even in a relationship that's been long term, can lead to enough pain that would stimulate growth in that relationship. And I don't want you to think I'm condoning these behaviors. That's not what this is about. But it's about understanding that not everybody fits into a box, and that we don't want to just say because someone is having affairs or that they have had an affair or that it's normal in a particular society that it's necessarily the healthiest choices, but it doesn't necessarily mean that they're addicts or that they have a deviation either, that a sexual deviation, so to speak, and that sometimes these things do trigger growth and sometimes they're normal. When we talk about bondage and sadomasochism, again, these are things that have become highly experimented of late. And again, I'm not suggesting that someone is wrong to try new things. It's very healthy and normal to try things, and especially once you've had the same sex partner for a long time. But the problem with some types of behaviors like bondage and pain and bringing in straps and tying up and things like that. The problem is that just like any drug in the brain, you need more and more to get the effect. So this is something that the people need to understand so that they don't have to have these types of behaviors in order to enjoy sex. Because once someone has to do these types of things in order to enjoy sex, they've lost that psychological and emotional and intimate and spiritual component of enjoying sex. And it should be something that people can enjoy for the sake of being together, not because they have to bring in all kinds of paraphernalia to make that happen. Next page, please. Okay, so one thing I want to clarify is that there's a difference between being addicted to a person, love addiction, which love addiction is where you're on and off, on and off, on and off. This can go on for years, it can go on for decades, or it could go on for months. But it's where you, in an addictive relationship, it's where two people cannot break through their own barriers to find a place of intimacy that's safe and consistent. In other words, they use sex, they reconnect, and then they get bored with each other, and they trigger each other, and they break up, or something causes the other to get mad at the other, and then it becomes into a very negative cycle, and they are not able to get past that in terms of understanding why they're reacting to each other, because it's usually not so much about each other as they've brought their childhoods and their past into the relationship. So when they cannot break through those unconscious barriers that manifest in the relationship, they form a love addiction where they can't live with each other and they can't live without the person. That's a little bit different than an attachment disorder, which is when someone has never had a safe or secure bond with a loving person, particularly in childhood. And so they have almost a phobic reaction to forming a safe attachment with someone who might even be safe. So I'd like to differentiate this because I think sometimes people with attachment disorders get bundled up with sex and love addiction, and I really like to kind of filter those out. It's not uncommon for someone with a sex and love addiction to have an attachment disorder. Clearly that would make sense, but I just want you to also understand that sometimes people with attachment disorders do not have sex and love addiction disorders. Let's go to the next page, please. Okay, so this is a cute little video that my daughter did this PowerPoint presentation, and it shows, kind of in a funny way how we can be trapped in addiction, and I'm having a little trouble reading this, but really I kind of covered it already. The couple in the sex and love addiction, there's some certain traits. They have a very strong physical, male, female, same sex, or whatever the case may be, but they have this really animus type of attraction towards one another, and they feed off of that. And they also might find each other very, stimulating in terms of intellectually, but it's not like the kind of intellectual stimulation that comes from bringing new resources into it. It's kind of like a one-upmanship, or a type of predator to predator kind of thing. It's how intriguing can this relationship be? In terms of sex and love addiction, intrigue is one of the big key components that often the person who gets hooked on the hooker, let's say, I don't mean that in terms of prostitution, but the one who hooks the other, there's a tremendous amount of intrigue. The person often has never experienced this type of rejection or this type of treatment, and they're intrigued of how could someone possibly treat me like this? And so they get stuck there. Often people in sex and love addiction, they play well together. They have fun. They know how to really cut loose, and they get each other in that respect. But again, when it comes to trying to solve the natural and normal problems of intimacy, they are unable to do that. Let's go to the next slide. So we've already talked a little bit about the severity of the problem. And we've also talked about, symptoms of both sex and love addiction, but we'll go over it a little bit more here. The person prefers to focus on sex or a relationship than focus on oneself. This is really key and really important, because it's another distraction. It's no different than drugs and alcohol. If I'm constantly focusing on this other person, what they're doing, where they're going, how they're making me feel, what they did wrong to me, then I'm not really looking at my role in my life, and I'm not taking responsibility for my role in my life. One of the things that I do with people is try to tell them, you are not on the planet to have a painful relationship. That's not why you're here. However, people are brought together frequently so that they can heal their past. And when we miss that very important and key component, it's very unfortunate. So when I'm working with a couple or an individual, I always try to help them tie this to what was their family of origins model for relationships? How did they feel about love growing up? Did they feel loved? Did love mean hurt? One of the things that's so important for people to understand is that pain is not love. This is one of the most difficult concepts for people who are struggling with sex and love addiction to understand. I'm in so much pain, I must really love this person. No, you might love the person, but if you're in so much pain, you're lacking self-love. And we need to work from that place outward, because love is not pain. And even though, of course, we're going to be sad and we're going to mourn and we're going to grieve if something isn't working out, and that is painful, the suffering component comes from not letting go and from not growing and not being able to change. So I really help people to understand that if you're in pain, that's got roots to it. And we need to work from this relationship backwards and free you from that entanglement of feeling that love is pain. There's denial, sex and variety. Again, it's fine to have variety. It's healthy and natural and normal. A couple that's an adult, that are adults, get to decide that for themselves. But if there's a problem resulting from that type of variety, that needs to be looked at and examined. Like any other addiction, there's an increase in tolerance. We talked about that earlier. You need more and more of whatever gets you off to get the effect. Some people start on pornography just watching, normal type of sex type of things. And then before you know it, they're in all kinds of rooms that they would never go on the dark web, because they've been led there through that increase of tolerance and needing more and more to get the effect. The inability to act on logic over emotions. People will often tell me when I'm working with them, I don't know why I keep doing this. I can't figure it out. I'm ready to give up. I don't understand it. This isn't working. And, that compulsion to continue no matter what is in place. And that's really debilitating to someone's self-image, self-esteem, and self-worth. So we want to be able to work through that. And then this last one here, won't tolerate withdrawal symptoms. I want people to understand that when you're dealing with sex and love addiction, the withdrawal symptoms are as bad, if not worse, than coming off of heroin, morphine, or some of these other crystal meth, some of these other really opiates, these drugs. They describe all the same things. The headaches, dizziness, can't concentrate, can't sleep, can't eat, can't stop eating. Whatever people are going through when they're coming off of these other substances, they experience that so fully when trying to come off of a sex or love and sex or love addiction. It's really the cravings, it overrides again, the logic. It overrides everything and makes a person feel that they just are never going to be okay. And so one of the things you want to help people to understand when you're working with sex and love addiction is that this withdrawal is normal and that they are going through withdrawal. And after a couple weeks, usually 2 to 6 weeks, it will subside just like any other addiction. But again, you want to make sure that they're doing the kinds of things to replace that addiction, just like they would in recovery, eating healthy, going to meetings, and having a social life, learning how to love themselves. I have a handout that I'm happy to provide any of you. It's 101 plus ways to self-love. And I tell people, do 5 things a day on here and you will recover much faster than you think. And it works very well because really all addictions are nothing more than a substitute for love. And most of us, I know I didn't know what love meant when I came in. I thought I did. So I don't want, I want as a recovering community, I don't want us to have to go through decades of figuring all this out. So if we address these kinds of things in treatment, then we can really accelerate a person's healing and they can have the kind of life that they want, whether they choose to be in a relationship or not. Let's go to the next page, please. Okay, so the causes, failure to form a secure attachment with a primary parent or other role model. What is a secure attachment? Well, there's no perfect attachment, and we want to make sure that everyone understands that. Freud says it doesn't have to be a perfect bond, it just has to be good enough. So what is a good enough attachment? Well, that means that when you're young, you had at least one caretaker who was safe. You knew that you were going to be fed, you knew that you were going to be clothed, you knew that you were going to be cuddled, you knew that you were going to be soothed when you were upset, and that parent was emotionally present for you, and that your needs were met. Enough, not perfect, but enough where you could count on that consistency. So it's very common in people with sex and love addiction that there is not enough of that, or it's intermittent. And so what the child learns is that they can't count on that. And so if you've never experienced it, you can spend your whole life looking for it or avoiding it, depending on whatever the issue is for you. The second thing is failure to have physical, emotional needs met consistently enough. We've already covered that. Rupture in the childhood bond. So let's say that there was a secure bond, a secure attachment, but something caused that to rupture. Children who lose their parents or through death or whatever cause, divorce can if there's parental alienation by one parent or the other, that would be a rupture in the bond. It could be that a parent became had to go overseas or was injured, or any type of thing. A parent develops addiction. Any type of thing that takes that safety and security and upends it, that could be a rupture in the bond. what we want to understand in terms of sex and love addiction is that when there's ruptures and problems with attachment, that we really want to help people to go back there and face these things and work through them and heal them. We never want to be blaming parents and all that, but we do have to look at those things and how they factored into our psychosexual development and our emotional development. Because if we don't do that, we can't heal those wounds, and then we can't transcend them. So the key here is that eventually I form a secure enough attachment with myself, and I know how to meet my own needs in a healthy way so that I'm not using my partner or partners or whatever the case may be to get needs that weren't met early on, because that is a never-ending story and it doesn't work. And it just leads to a lot of trauma and a lot of pain. Another cause here is that when children witness dysfunctional relationships in their parents, they tend to reenact those same things. And if you think about it, it's just like if your parents spoke a foreign language and then all of a sudden you're trying to learn a different language with a new partner, it's you can't really do it. So we tend to do exactly what our parents did. That's what's in what I call our template. And so we have to learn what is healthy and practice those healthy behaviors. It could be a reenactment of childhood sexual abuse. Almost all people that I've worked with who've had sexual addictions have been sexually abused. Low self-esteem. So people are substituting sex and love and relationships or whatever they're doing here to feel that momentary relief from a low self-esteem. The problem is that it just creates lower and lower self-esteem instead of bringing someone into a better place. One of the main things that has contributed to sex and love addiction is that, we've been so programmed through advertisements, through music, through films, to be able to have this happy, perfect, love stories and the music and, I'm dying if you've left me, or I'm happier than I could ever be if I found the one. And so this is like imagery that a lot of people have been programmed, and we don't even realize that it's happened. So we want to be conscious of that. And again, music and movies and all that are wonderful, but we just want to be very careful that we don't adopt that as the way. And then again, another cause, it can naturally occur through an increase of tolerance, and we've already covered that. Next page, please. Could we see the next page, please? Oh, I'm sorry, deadly. Okay. Okay, so sex and love addiction is certainly deadly. Here are a few of the things that can cause it to be deadly. When people are into, you can have an intensified orgasm when there's an oxygen deprivation to the brain. And sometimes people will choke one another or even hang themselves, and a lot of accidental deaths. They're saying here between 250 and 1,000 deaths per year. And again, this is an extreme measure that people will do to be able to get that desired effect. So that's why it's an addiction and not just a normal type of experimentation. Another cause of death is that it leads to domestic violence. And this is, 10 million people in America are victims of domestic violence. And these sex and love addiction, or even just love addiction relationships, can become very deadly. People stab one another, they plot murders, they stalk one another. It just escalates and escalates and escalates until someone dies. And this is a very, very serious problem. Accidental deaths from sadomasochistic types of things. Autopsies have shown that people have been shocked to death. Sometimes objects. I had one case one time where somebody was putting a live gerbil into the rectum in order to have an intensified orgasm. These are bizarre and extreme examples, but the gerbil had to be surgically removed, and all kinds of horrible types of consequences from that type of preference. And this might sound bizarre. You would be incredibly surprised at, and people really don't talk about this much because they're too ashamed and embarrassed. But there is so much stuff going on in terms of the sex addiction component that it is really very, very concerning. And that's another reason that we really need to address these things, no matter how shocking and bizarre they may sound. We have to talk about it. You know, when I came into recovery in 1986, they didn't talk about these things. And so people were just kind of left out, you know, midstream and trying to work through it. And we really owe it to our patients to, you know, help them to say it's okay to talk about this. Whatever anyone's doing or whatever they're experiencing, again, we don't want to shame or blame or judge. We just want to try to help them to be able to understand the difference between healthy and unhealthy, and to learn to love themselves enough that they can adopt healthier behaviors and things that are threatening their lives, because we don't want to lose people through this type of behaviors. We talk about STDs, sexual violence, and harmful practices that are physically injurious. Those are sometimes accidental causes of death as well. Let's go to the next page, please. Okay, so therapeutic approach. Well, I think we skipped the page. Back to 19. No? Okay. Okay, treatment and recovery. There's a tendency to avoid addressing SLA addictions in treatment, and this model must be changed. I see this a lot before I make a referral to treatment. I always have fully explored people's isms, if you will. You know, what all are they struggling with? Do they have a spending addiction? Are they gambling? Gambling isn't necessarily with money. Sometimes they have a gambling personality with their businesses, with their relationships, their high-risk behaviors. It could be someone who's into extreme sports and doing things that put their lives at risk. So it's that adrenaline charge that comes from that type of gambling mentality. But whether it's sex or love or work, whatever the case may be, I really try to get a full and thorough type of analysis of where their addiction, addiction is what I call an invisible hole, and that feeling that something is missing. And so just because I give up drugs and alcohol doesn't mean that I am healed. It means that addiction, until that invisible hole is filled with self-love, it's going to keep seeking. It's like a heat-seeking device. And so I want people to recognize that whatever their tendencies are, let's address those. So when I'm sending someone to treatment, I always ask the facility, if I have someone who's suffering from sex and love addiction, or one or the other, do you treat sex or love addiction? And if they tell me yes, I have learned to ask, what kind of model tell me how you do that, because I have made referrals and they didn't. And the person got sober, left with their sex and love addiction, and was not able to stay sober, or certainly didn't have a quality of life that they could have had everything been addressed while they were in treatment. So this is something that we want to talk about and help people to and again, I think self-evaluation is really important. Help the patient to understand the correlation between relationship problems and relapse. I know that we hear about that, no relationship for the first year, but that tends to go in one ear and out the other. And again, it's like, don't get that cookie out of the cookie jar. This is not a constructive approach, particularly with sex and love addiction, because healthy human beings want to have sex. Healthy human beings want to have relationships. unhealthy human beings want to have sex and unhealthy human beings want to have relationships. So what we want to try to achieve here is to develop a vision of what a person wants in their sex life and in their relationship that will lead them to a happy and fulfilling intimate relationship, first with themselves, second with others. So that would mean that they, as we touched on earlier, that would mean that they, while they're in treatment, they learn how to take good care of themselves. What does it mean to love yourself? Who are you? What is your purpose here? What do you want to achieve? Do you think you're here to be on a porn site 5 hours a day? Or do you think you're here because you have a mission and a purpose? What does a healthy relationship look like in your mind's eye? Do you have children? How do you work through solutions? How do you see you and your partner working together? Do you see yourself having the same value systems? We want to help them achieve a vision that is going to give them a lifetime of fulfillment. This doesn't mean that they will, get married and have that fantasy relationship for their whole life, but it means that they will have that fantasy relationship with themselves so that they are happy, they are well adjusted, they are productive, they have friends, they have interests, they have hobbies, they have a fitness program, they have a spiritual program, they have a health program, and they are well-rounded. And so when that happens, they're very much more likely to attract the person of their dreams. But if not, they're okay too. So this is really what we want to have this so ingrained in people's minds while they're in treatment, that, and I say it over and over and over again, the most important person you will ever love is yourself. The most important relationship you will ever have is with yourself. And so if you're not at peace and you're on some kind of mission to find someone or to have the ultimate sex experience, that is not going to get you there. And what will get you there is learning how to love yourself and to really zoom in on these types of behaviors that will replace sex and love addiction with healthy self-love. So we want to be able to help them to evaluate that for themselves. And if we could pull up this next thing here, this is Mark Falango's therapeutic approach, but there's a self-evaluation. No, not that. No, it was on the previous page where we could click on the link and it's a self-evaluation, I believe. Yes, this is so good. I found this when I was preparing for this course. Like I said, I use my own, but this was really good because it's just for sex and love addiction. And you all will have that in your supplies. But when someone can kind of go through and answer questions for themselves, I was so surprised when I started giving self-evaluation questionnaires to my patients, how honest they are. And I'd always say, well, this is really honest. You've got like 10 out of 30 things checked off here. And they'll say, well, I wouldn't be here if I didn't want to be honest. But at the same time, if I would have asked them those questions, I probably would not have gotten as honest of a response. And the nice thing about self-evaluation questionnaires is that people are much more likely to be honest with themselves than they are with you. So every therapist should have these kinds of tools in your toolkit. And I often have them included in the intake forms so that people can do that, to have that self-evaluation. It's very powerful. Next slide, please. Okay, therapeutic approach. Well, we've covered a lot of that already, but here's some more general types of things that we want to be able to address. Avoid shame-based comments or conversations. Encourage healthy choices versus making the patients wrong. The former will inspire them, the latter will demoralize. This is so important. We want to inspire people to get better. We don't want to shame them into it. It does not work. Encourage immersion in podcasts, and other tapes and videos, YouTubes. It's amazing how many people who are stuck in addictive behaviors, they want to break out. And if they are directed to podcasts and YouTubes and things like that, the little videos on TikTok or Facebook or whatever, they will do that. There's all kinds of courses available. They will be proactive. So encourage that while they're in treatment to find these things on their own, or to point them in the direction where they can really get downloaded, so to speak, with good new information. Get support. I have here the link for SLAA. There's tons of online meetings now if someone doesn't want to meet in person, but it's just like any other addiction. You really need to understand how to recover from it. And sex addiction, you basically you choose a bottom line behavior. If let's say if you have a porn addiction, you're not going to watch porn. That's your bottom line behavior. You pick up a white chip for that, and then you get your sponsor, and then you work your program just like any other program. If you have a love addiction, you would have a bottom line behavior also, that you would say, I'm not going to have contact with this person for X number of days, or this is the only way we're going to have contact at the therapist's office, nothing in between, or whatever the case may be. But you are willing to change your behavior and to do that inner work that the steps and that therapy and that treatment provides. People can get better. People do get better. I'm going to give you an example of that in a minute. Psychotherapy and treatment is another alternative. If someone, isn't able to do it just through the 12 steps or through self-education, then they should try psychotherapy and treatment. I recommend that for sex and love addiction, that they have someone who has a lot of experience in that, because it is different. It's kind of like the eating disorder addictions. You still have to engage with people. We are sexual beings. We are beings that need relationships. So it can be tricky learning how to take care of yourself in healthy ways. And that's the full immersion into learning how to do that is very important. Let's go to the next page, please. Okay, so we want people to take 100% responsibility for their recovery. We stop blaming other people for why we're doing what we're doing. It's the same thing. I can't blame other people if I'm drinking or drugging. I'm choosing to do that. So it's really important to take that time when you want to act out, to not act out, and to do the self-love actions instead. Learn how to have a healthy relationship with yourself. Stop substituting the addiction for authentic self-love. This is key. And if someone doesn't learn how to love themselves, they will have a very difficult time recovering from sex or love addiction. Make sure when someone says that they want to get well, that they really do. So you want to pre-screen them to determine if they're really ready and willing to do the work. Be willing to address neurodysregulation. I just got a note here, sorry. Be willing to address the neurodysregulation. So in other words, when someone is so programmed to pornography or having to have certain like a bondage or sadomasochism or certain types of stimulation or fetishes, or having sex a certain way, often with sex and love addicts, they have rituals they go through. They may not be using paraphernalia and things like that, but they have certain rituals. All of these things are to avoid intimacy. So they have to understand that they're not going to go from here to a healthy, loving, intimate sexual or emotional relationship. That the brain is literally dysregulated. And just like when you come off of drugs and alcohol, it takes time to re-regulate the brain. And how to build a trusting relationship, time together, affection, honesty, sharing thoughts and feelings, zero negativity. Sex and love addicts are 100% negativity. So learning how to eliminate that and only be positive with each other, and saying and doing things that make the other feel cared about. Again, the most important relationship you ever will have is with yourself, and learning how to love yourself. Next page, please. I know we're running short on time, so I want to make sure that we finish everything here. Okay, so in therapy, work through the emotional blockage. So whatever unhealed trauma from the past, whether it's current or childhood, the grief work needs to be done. All addictions try to cover up our pain, and it doesn't work. It just builds on it. Teach effective communication skills, like teaching people how to talk to each other in healthy ways, talk about themselves and what they're feeling in the terms of I statements, as opposed to you always do this and you never do that, and blaming other people for their acting out. Emphasize friendships first and develop a strong support system. So when people say they want a relationship, your first and foremost relationship is with yourself. Then we can start talking about practicing with friends and learning how to be a friend rather than trying to get friends, how to be a friend. And then we can build from there on to learning what are the elements of a healthy love relationship. Help the patient to recognize that they and their relationships have a higher purpose. It's not just about getting. What can I get? What can, that's a predatory mentality. It's about sharing and receiving love. So how can I be a really good and healthy partner to myself and to my loved ones? Help the patient to understand the consequences of acting out and versus the benefits of acting in their own best interests. People will get triggered, and that's why they drink. That's why they act out sexually. That's why they gamble. That's why they do whatever they do if they're addicted. And so instead of acting out, how can I act in my own self-interest? And that means being willing to be uncomfortable when I want to act out, sitting with my feelings, journaling them, working through them in therapy, and getting to the roots of why I'm doing what I'm doing, and then replacing that with healthy behaviors instead, like communicating your hurt, your pain, your loneliness, first to yourself and then to other people. Okay, and I like to use imago therapy. We don't have time to go in that here, but it's a whole nother level of couples counseling where you not only learn effective communication skills, but really good how to listen, how to give feedback, how to recognize how you're triggered from your childhood, and help each other to understand your individuality, that you're not the same, and how to have empathy instead of don't you get me? And those kinds of things. It's really powerful therapy. And Harville Hendricks and his wife actually had their own struggles with their own relationship, even despite all their knowledge about how to get the love you want and things like that. So I really encourage you to learn about imago therapy if you're going to be helping people. You don't have to be a couples counselor, even if you're just helping someone learn how to be a better partner to themselves and others. It's very powerful work. And then sex therapy. I think this is really important for people who are recovering from sex addiction and sex and love addiction too, for that matter. I know I'm talking really fast, sorry, trying to cram all this in, but to be able to see a therapist who specializes in sex therapy. And the reason for that is when someone does not know how to have normal sex, or they've been so conditioned to addictive sex, it's important to either the individual or a couple to be able to work with a sex therapist who can take them through successive approximations of behaviors that can lead to a sexually intimate and loving relationship. Next page, please. Okay, so we need to address resistance. That's really important. And basically, when we're doing that, we just want to understand that most people aren't coming and saying, yeah, I'm all ears, let's do it. So here's some suggestions on how to do that. They'll say, I don't understand or know what you're talking about. You don't realize everyone is doing this now. If I'm not on apps, I won't have dates at all. And then there's endless diversions and deviations from doing the work. So we can just help people to understand that this is resistance. And if when they're ready, then they'll be ready. But right, if this is coming up, some of it's normal, but we want to ask them, are you ready to move through this discomfort that you're feeling? Go ahead. Next page, please. Okay, so I'm gonna have just like 1 minute here. I had a 30-year-old male who was suffering from sex addiction. This person is a physician, was in recovery from substance abuse. had a pattern of serial monogamous relationships, and but continued to have sex with himself outside the relationship. Actually wound up in a really healthy, ideal type of relationship with someone, and hit the same walls that he had been hitting in previous relationships. So I'm saying that this is a successful case history because while the person is still struggling and still having some setbacks and some relapses, the person is working a very strong program. The person is learning. These things are multi-layered, and you're not just going to say, you know, like go to AA and work the steps and it's done. It's much more, when you're talking about sex and love addiction, there's much more layers to that. So you have to be willing to be very patient, understanding with your patients. And again, it's progress. You know, let's look at your progress and let's go a little bit deeper. And you're going down a lot of different areas and to their minds and all. So there's tremendous progress here. The relationship is getting better. This relationship required some couples counseling as well as some sex therapy to help them to be able to understand healthy sex and love relationship and intimacy. It's very scary for a sex addict to be able to be intimate, but this is a success here. I'm going to skip down to the failed case history. I had a 40-year-old male that I referred to treatment for sex and love addiction. They treated for substance abuse and sex and love addiction. They said they treated both. They did not. His therapist told him, oh, don't worry, it's okay to be in your relationship. You know, it's kind of a rule of thumb that you don't. And he wound up relapsing because he was in a sadomasochistic sex relationship, and he was sober, but he obviously could not stay sober for long with that going on. So some people might, he didn't. I'm going to wrap it up because I know we're out of time. I'm sorry. We had a little electronic problems this morning, and I'm trying to do this off my phone instead of my computer, so it's a little challenging. But thank you all so much for being here, and I love doing this.
Thank you, Dr. Marks.
Thank
we
you.
will now answer some of the many great questions we've received. I know we're coming close to the hour. So for those of you who are looking, if you could circulate that handout, we will, Dr. Marks, if you can share the handout that you referenced during the presentation, we'll get that to everyone as well. So thank you. So one of the questions that we wanted to ask are some the audience, could you speak to the trauma bonding and personality disorders as contributing or perpetuating to these disorders in individuals and relationships, Dr. Marks?
Yes, well, trauma bonding happens when generally happens when there was a negative bond with the parent, a love-hate kind of relationship with the parent, where the parent made the child feel good and close some of the time, but then there would maybe be addictions or physical, emotional, sexual abuse as well. And so what happens there in the wiring, or what I call the template, is that love means something bad's going to happen, something's traumatic's going to happen. I can only feel safe for so long, but it also feels perfectly normal when I'm an adult to have those kinds of reenactments. So that's really what trauma bonding. In terms of pathology, that may or may not have to do with trauma bonding. I don't like labels at all. I don't like to label anybody. I always see any type of label as a certain kind of pain that a person is in or has gone through. And so I'd like to just try to really understand what happened in childhood and how it's being reenacted now. Personality disorders, I just feel people have had more trauma and are suffering more pain than the general basket of variety of childhood stuff that goes on. And so they're stuck there. So as therapists, we need to understand that we have to be very patient. This is not quick fix therapy. I do not believe cognitive therapy is going to help for long-term lasting in terms of intimacy and healthy relationships. It can help fix the symptoms, but you're going to have to go a lot deeper and take the relationship with the therapist is going to be the healing factor, that you are going to become the role model that they didn't have, that takes them through the frustrations, the ups, the downs, the challenges, the tests. And so you really need to make sure that you're up for this and that you're whole and solid enough. And if not, get some supervision to keep you there, because this is really where the key element is in healing, especially sex and love addiction, that they're going to learn from you what healthy is. They're not going to learn it on the streets.
Yeah, as you were talking, I was thinking about the attachment slide that you had and the secure attachment and kind of going through that process. So thank you, Dr. Marks. Really, really thank you so much. Another question. I know we're just about out of time, but thanks again for everyone. We'll follow up with answer your questions separately. This is a question for Dr. Gordon, who's also here. How does Caron address sex and love addiction? Dr. Gordon, would you quickly address that and introduce yourself if you don't mind? Thank you.
Absolutely. Hi, I'm Dr. Sequoia Gordon. I work at Caron Ocean Drive. I think the best way to answer that, I break it down in phases. So initially, we get a pre-admit, which is just information about the patient and what's happening with them. Similar to what Dr. Marks mentioned with her own assessment, we have a version of that we're looking for further assessment about the history of their relationships and sex. Excuse me. We're looking for whether this is behaviors independent of substance, if this is a behavior that's enhanced by substance. So we take a look at all of those things. The other piece that's important that we look at is trauma. If there's a history of trauma and some of the core beliefs that's developed about sex, about the body, about relationships around that. So we tend to really explore and take a systemic look in the assessment phase, so the messages and so forth. Then I like to call it the treatment phase, which, by the way, assessment is a continuous process. So even though we have those initial questions answered, we want to make sure we're still curious. We don't want to pretend like we know everything about their history. So we stay curious in the treatment phase. Dr. Marks touched on a lot of what we do. So some of this would be a little repetitive, but we want to know what's the goal. Is this their readiness for change, right? So what's the actual ideal relationship with sex or love that they want, relationships that they want? And then we work from there. Obviously, we have to provide some psychoeducation. I am also a family therapist, so the templates from how they learned about sex and love is usually rooted, like Dr. Mark says, in the family of origin. So we take a lengthy look at that. What's the template of love and sex that they learned? The attachment pieces, how that's incorporated into that as well. And the last phase that we look at is the support phase. So essentially, if we're working with a client that's working their way through our program, at discharge and even during the process, SLA meetings is something that we highly advocate for. One, it reduces shame around what they're going through, because a lot of times folks hide it. They feel like this is something I can't share, can't tell people that this is something I experience. So that part is huge when there's support and they learn that other people are struggling with some of the same things that they are. And then at discharge, we want to keep them involved in some support groups. Definitely, if they're out of state, we want to make sure that there's a CSAT, a certified sex and addiction therapist, that could continue some of the work, sign releases, of course, so we could talk to them about the work that we've done and just really collaborate to make sure that patient, when they leave, they're going into continued treatment. And the last thing, especially when they're leaving, is cope ahead skills. How do they substitute the behaviors with something healthier? Is very important. So that's the systemic approach that we take here at Caron.
Thank you, and thank you for the discussion around family systems and the importance that to address family systems, the patient's the family and the family's the patient, as our motto is here.
And
so
I just
thank
want
you.
to add that kudos to Caron, because not many treatment facilities are doing that comprehensive of an approach, and it's excellent. And I'm so, I really I just really want to stress that it's not easy to branch off into that. It's easier just to let's focus on the primary addiction. And there is no primary addiction, it's just one, so however it's manifesting, that's great that you guys are addressing it. Thank you.
Thanks, Dr. Marks. Thank you, Dr. Gordon. Thank you for this. Thank you very much. And thank you, everyone, for joining us today. We encourage you to stay connected with Caron through regular email updates, social media channels, and websites. We also want to remind you to finish and complete the educational credits and the evaluations to get those credits. We also really want to talk and share about our commitment for access to care and really going after the organ that all the disease kind of lies in, which is in the brain. And we've launched a 10-day neurocognitive assessment that we're really focusing on how to optimize the brain and really define and clearly understand the deficits of what we're facing, whether it's through neurocognitive assessments, through neuropsych testing, through concierge lab work to identify any of the stress levels, as well as our neuromapping and FDG PET scans. Let's get to the bottom of what's really going on so we can create a prescriptive treatment plan to help our clients. So we're really excited about that program. Please reach out to your local business development regional resource director to get more information about that. Again, we are really excited that you all could be here today. That's a list of all our regional resource directors in your regions. Please learn more about Caron, caron.org. And we're just, again, please keep an eye on your emails for the continuing educational information. So thank you very much. And thank you, Dr. Marks, for an incredible experience today. And thank you, Dr. Gordon, for joining as well. And looking forward to bringing more webinars to you all so we can get more information and be able to help people better. Thank you.
Well,